Hi, Dr. Kathy. Touch Part 2. Let's call it sexual sensations, okay? All right. So you know that I love touch, right? We have all these sensations. To me, touch is way at the top. We need them all, but touch, it does the most sensual thing to us if you get it right. And it does take practice to get it right, okay? All right, so let's recap. The brain. Remember my brain? The brain is where, when we touch, all those nerve fibers go straight to the different parts of the brain and communicates to us, turns on all these reactions, and then goes back to our groin, goes back to our body, and turns us on, right? So those fibers are slow, especially for the emotional, social bonding part, and fast for the discriminatory part, where you discriminate between, pressure and vibration and, how hard or how light you are being touched. So that's a fast sensation. That's more in terms of regular sensations. We're always being touched. And it's like second nature. We don't even think about it. But there are people that cannot feel when they're touched, right? They have some sort of neuropathy or some sort of nerve damage. So remember, touching is very important. And as we age, touching actually gets weaker. So you've got to practice and keep that art intact by making sure that you're aware if you have any conditions, any medical conditions that will take away sensations. So see your doctor, get that physical. And also listen to your partner and listen to yourself when you say, oh my gosh, things are different, and get that checked out, okay? All right, so we're going to talk about erotic areas that you and your partner can touch, and you can touch on yourself to actually evolve and evoke that sensation of erotic pleasure, okay? So remember, erotic zones. Where do we start? Of course, the brain, all right? So we have to talk, we have to act, we have to do things to turn on the brain so that we can feel somehow pleasurable when we're being aroused. Because if someone touches you and you are angry with them, you're not going to be aroused, right? You're going to actually be turned off. But if you're in a good mood, which means you've done something great with each other, or you've talked about something really pleasurable, or you've gone somewhere, you've gone out, then you're going to feel much better when the touch occurs, okay? So let's talk. I've got so many erotic zones. Top to bottom. The scalp. The hair, right? We can have a massage up there. Ooh, isn't that a great pleasurable area to have a massage? So you really want to be able to find out, does the person like it? Do you like it? Always, when I talk about touch, find out whether your partner likes it. You're going to get a response. You're going to know by how the person responds. You're going to find out how the person sort of goes and moans and makes a noise indicating that they like it. So always go further. If not, if it's quiet, if it's silent, don't go further, or ask, do you like this? And then let them let you know whether you like it or not, okay? All right, so that's the scalp. Let's go to the face. The face. People sometimes like to be touched in the face and sometimes they don't, depending on whether they have makeup on, right? Women, we know that. And depending on whether they have different sensations, again, about the face. You've got to find out. Some people like to be kissed, right? So find out. The face. The nose. Another one, right? The ears. We know the lips. So these are areas that you can touch with your fingers. You can touch with your lips and your tongue. You can touch with different, of course, toys. We know that. But find out. You don't want to nibble the ears? That's okay. And this is for both men and women. When I go to the genitals and areas that are different, I'll let you know, and we'll talk about them differently, okay? I like the neck, the nape of the neck, the side of the neck where the shoulder and your neck meet. I don't really like the front of the neck. The front of the neck sometimes I think is a little bit uncomfortable because of course you have the Adam's apple there, you have the thyroid there. You don't want to feel like you're being choked, even though that's another way of touch, right? But we're not talking about choked right now. So try and stay between the nape of the neck and the angle of the shoulder and the neck, and try and do the light kisses, sometimes feathery touch, but remember, don't do it if they're ticklish. If they're ticklish, stay away. Put more pressure on it so that they don't get the tickling sensation, okay? All right, what about the chin? Some people love to be kissed and love to be sucked on the chin, the jaw, the angles of the jaw, okay? You go down the clavicle, right? Some people love to be massaged there. And again, massage is a great way to have touch enhanced, right? We know that, right? The back, right? We know about the back. Sometimes you get a nice massage, especially when the muscles are tight. Oof, I need one of those right now, right? Let's go further down. In a woman, we've got the breasts and the nipples. You really want to get that aroused, but the technique is, again, crucial. Is it light? Is it rough? It all depends on your partner. Do you nibble? Do you bite? You've got to find out and try these different areas and techniques depending, again, on your partner, okay? And you can do it on yourself too, right? Wink, wink. All right, men, some men love it, some men don't. You're gonna find out, so just ask. Again, touch lightly, touch roughly, and find out which pressure they prefer. Let's go further down to, well, the chest is there for men, right? Some guys like to be rubbed on the chest. If you have some oils, remember my sex oils are great for that. If you have some oils, some massage creams, you can actually get them really oiled up and see whether they like that. Then you can move down to the stomach. The stomach area is a lovely area with the belly button in particular. And some people don't like the belly button being touched or rubbed or kissed or licked or sucked. Again, depends on your partner, but don't forget the belly button. Another erogenous area is right below the belly button, the lower abdomen, where we call it the pubic hairline. That can be very sensual, right? Again, depending on the person, you might want to move to the back, the curve of the back. You can do a massage, you can do knuckling, you can do feathery, you can do kissing, you can do sucking again, depending again on what you're trying to elicit in your partner and how they respond. Always be astute, always be aware of the response. Are they moaning or they're cringing? Be aware, okay? You move down the lower back to the buttocks. Ooh, people love to be touched or slapped or kneaded or knuckled. Again, kissed, caressed. You want to, each time you have that sexual encounter, you want to do something different. So try something different next time and ask, do they like it, right?